My name is Evelyn Bragg, and I'm here to give you some information or health history of my patient. My patient is an 18-year-old African-American female. She presents in the clinic with bilateral great toe pain. She's a full-time college student, and she has a part-time job working as an after-school activities assistant. She stated that the pain on a scale of 1 to 10, it rates at its worst an 8 out of 10. And it worsens with long periods of standing. And her job requires her to stand at least 30 minutes at a time. She states that the pain doesn't radiate to any other location, to anywhere proximally. It's just the toes, the big toes. She states that the reoccurrence of the ingrown toenails, they take place at any time regardless of the type of shoe or whatever type of activity she's doing. She does practice good hygiene in the area. However, unfortunately, the toenails seem to grow back and bother her and cause her pain. She describes the discharge as clear on her toes, but it doesn't have a foul smell. The areas are pruritic and cause discomfort with scratching. Once the areas are healed around the toe, she notices that there's a dark ring around the toe of her skin. The skin is dark. She changes her shoes to accommodate the affected areas. However, her job requires her not to wear open-toed shoes. So the only shoes that provide her comfort at the time are open-toed shoes. She has had a previous history of wisdom teeth extraction, and she also had a right lateral malleolus fracture. She states that she has no known drug or food allergies. However, she did tell me or report that she does have difficulties swallowing pills. This patient is unmarried. She lived with her parents. Her father is currently active duty, and he's deployed overseas. She's a full-time college student, as I stated earlier, and she works part-time. She has no history of smoking, alcohol, or illicit drug use. She has some pain when ambulating, but it's just basically her toes. She is at a low risk for suicide or major depression. Her family history consists of her mother has Graves' disease, her father has hypertension, her maternal grandmother has type 2 diabetes. She has had a myocardial infarction and triple coronary artery bypass surgery. Her maternal grandfather, he's deceased from prostate cancer. Her paternal grandmother is deceased from multiple myeloma, and her paternal grandfather is also deceased due to oral cancer. This concludes my little portion for the health history of my patient. Thank you.